And good morning, or good evening, or good afternoon, wherever you might be in this age of virtual conferences. Welcome to the second week of the 2021 National Shared Mobility Summit. Thank you for joining us. I'm coming to you from Seattle, the ancestral and unceded land of the Duwamish and the Coastal Salish. The Shared Use Mobility Center, which is the host of this event, is headquartered in Chicago, located on the traditional and unceded homelands of the Council of Three Fires, Ojibwe, Odawa, and Potawatomi nations. For the benefit of our visually impaired participants, let me describe how I appear on the screen. I'm a middle-aged Asian man with brown skin and short black hair. I'm wearing black rimmed glasses and a white shirt. The summit is virtual and distributed, so we'll see you today and 2 more Tuesdays this July. And don't forget our Thursday Echo events featuring our Mobility Justice Spotlight. I'd like to take a moment to thank Uber and all of our sponsors for supporting this event. We couldn't do this without your generous support. As you know, the theme of the summit is the big shift, and the scene behind me is exactly what we need to change and shift. It's the I-5 highway in Seattle. It was built to move thousands of cars running on fossil fuels. It was rammed through First Hill, a historically Black neighborhood, and the Chinatown International District. It displaced families in severe deep social ties. It devalued property and shuttered businesses. The pollution it generates and continues to generate disproportionately affects Black and brown children and households. The I-5 highway running through the heart of the city is literally structural racism, injustice cast in concrete, and part of the vast infrastructure that has precipitated the climate crisis. You can fill this with electric cars, but it still won't solve the inefficiency of moving 1 or 2 people in 2-ton vehicles. It still won't work for the 17% of the population who can't afford to own cars, most of them Black and brown households. We need more shared mobility that works for everyone. This is the conversation that drives the content of this summit. We need a big shift. We also want to shift power relationships in the way we conduct this summit. So if you'll notice, instead of keynotes, we have key conversations. We want people to talk to each other, not talk at each other. You'll notice we don't have moderators. We have hosts. Our hosts have the power to decide what they want to have a conversation on and who they want to have a conversation with. We just did the legwork. Our 2 hosts for this Tuesday are Ashley Putnam from the Federal Reserve Bank of Philadelphia and Daniel J. Harris from Elemental Accelerator. Ashley leads the conversation in the morning, Daniel leads the afternoon session. In between and after that, we'll have breakout panels. Check out the list of sessions on the links to the left of your screen, and where you and also participate in the chats to the right of the screen. After each key conversation, we'll have hallway conversations where you can meet other participants and share some of your takeaways. One more thing, we won't spend much time introducing the panelists. Their bios are available on the events website if you need it. We'd rather spend your valuable time and their valuable time talking about valuable things. So let me not take up more of your time and pass you on to the host of our first key conversation today, Ashley Putnam. Ashley?
Thank you so much. And it's such a pleasure to get to be here today and have this very critical conversation at what we all know is also a very critical time for our economy. So to describe myself, I am a white woman with brown hair. I am wearing a light gray jacket and sitting in front of a green background that says Federal Reserve Bank of Philadelphia Economic Growth and Mobility Project, which is the strategic initiative that I direct at the Philly Fed. However, the things that we talk about are critical issues that are really happening across the country and really in our economy at large. So before we dive in, I do have to give a standard Federal Reserve disclaimer that my views expressed today are mine alone and do not represent the Federal Reserve Bank of Philadelphia or the Federal Reserve System. Now that we've done that, I'd really like to talk about why we are here and why is the Fed interested in mobility? Why is this a conversation that we're having? As you all know, we are really at a critical moment in our economy where things are beginning to reopen, but we are seeing an exacerbation of disparities that existed long before this pandemic, if we're honest. What we're seeing is that workers of color, Black and brown workers and women, workers without 4-year college degrees and young people are disproportionately losing their jobs and not being able to reconnect to the economy in the same way. When we look at our data on recovery, we see that college degree holders are accelerating and getting back to work, and everything seems to be going fine by that measure. But when we look at those workers who are in low wage jobs and in unstable positions, they're really not seeing the same recovery. And so we really began at the Philadelphia Fed to think about what does it mean for our recovery, not just to be equal, not just to be back to normal, because we know normal was not working for everyone, but what does it mean for recovery to be equitable? And one of the critical issues we have identified is that there were barriers in place long before this moment, and transportation is one of those critical barriers. If you look at the data right now in terms of how people are able to access work or get to work, what we see are increasing number of jobs, particularly what we call opportunity occupations, that are jobs that pay above the median annual wage adjusted for living. These jobs are growing outside of the urban core. And we're seeing this suburbanization of these jobs. And one of the major concerns that I think ties together all of the work, all of the fantastic folks you're going to hear from today, is this desire to get to the heart of getting people to those jobs and really making sure that we're addressing the systemic barriers to inequality. We've also been looking, of course, at the Philadelphia Fed because we follow fun things like the price index for cars that are climbing right now. We see increased demand, if you read our beige book, for things like vehicle purchases, even used vehicles. And so when we also look at the data we have around household and economic stability, where 1 in 4 households cannot afford a $400 emergency expense, we have to wonder how are families that are unable to afford that expense going to be able to purchase a car if that is the only way to get to work. So I really appreciate Ben's opening because I do think that is at the heart of the conversation today. So I'm really excited to be here with some fantastic folks from our region. And I think what is potentially most invigorating to me about this conversation is that these are really different approaches in different parts of the Philadelphia Fed 3rd District. We have New Jersey, we have Northeastern Pennsylvania, we have Philadelphia. But what ties all of this together is a common drive around helping people access opportunity. So I'm going to open up and have my panelists just very quickly introduce themselves, tell us a little bit about your work. And I'm going to ask you to answer a very quick question at the beginning, which is what motivated the work that you were doing, and tell us about the region that you serve. So maybe I'll start with Tim.
Oh, good morning, everybody. Thanks for having me here today. I'm really excited about this. This is an issue that I've been working on for a very long time. So my roots to this issue goes back to 1997 at least. And let me explain for the visually impaired who I am, what I look like. So I'm an African-American male, older male, and I have a gray beard. It's a COVID beard. Gray hair, and I have rimmed glasses and a tan shirt. And I'm sitting in my home office that I've been working out of for over a year. So I plan to go back to my physical office next week. But getting back to Ashley's question, 1997 was pivotal simply because it was a year following the Welfare Reform Act. And so as you know, or may not know, it forced a lot of people who into the workforce, and there were mandates and so forth. And one of the early things that we found out was transportation was a major barrier, particularly for those living in urban areas like Philadelphia. So I was one of the early architects of what came out of that called Joint Access Reverse Commute Program. Interestingly, some of the same barriers that existed then still exist today. So we live in an area of Philadelphia where job growth has been sort of static. You look at a graph, it sort of goes up a little bit, but in the suburbs, the job growth it keeps going up. But the big differentiator is the barriers. How do you get the people, the labor force, in the city to those jobs out in the suburb? So that has guided my work even up until now with Ride to Work. We're in our 3rd year. In our first year, we made 24,000 rides, people getting a good paying jobs.
It's amazing, Tim. And I'm such a huge supporter of your work. And I love the context you've set because again, as we mentioned, these issues around mobility and prosperity and poverty even are systemic and not new to these, but obviously things that are becoming very critical in this moment. So Laura, I'd love to turn it over to you to introduce how we got into this work and talk a little bit about NEPA moves.
Absolutely. Thank you, Ashley, and good morning or good afternoon, everyone. I'm coming to you from northeastern Pennsylvania, the northeastern quadrant of the state, in the Scranton-Wilkes-Barre area, and I'm the president and CEO of the Scranton Area Community Foundation, which is a community foundation, community philanthropy, like most states in the United States and even internationally have in terms of helping donors achieve their charitable objectives, but also in many cases, prioritizing areas of change that really need focus to make a difference within the region that we serve. And so just a little bit about me. I have long, light brown, wavy hair. I am a white female, and I am wearing, I guess, pastel summer colors, a little bit of turquoise and trying to keep the summer vibe going. And I'm sitting in front of what we have as our NEPA Moves logo, which is a logo that highlights everything we want to highlight about what NEPA Moves is. And like Ashley mentioned, NEPA Moves is the transportation initiative that the Scranton Area Foundation kicked off about 5 years ago with the Federal Reserve Bank of Philadelphia. And since then, what started at a table of 12 individuals coming together to think about how can we strategically look at issues of where the barriers of transportation are at in terms of job access, healthcare access, et cetera, making sure we have an equitability focus and an equity lens with transportation. And at this point now, 5 years in, NEPA Moves, which is the name again of the transportation initiative, has grown to about 100 collaborative partners across the region. It's going strong, making some progress. But the reason we came to the table is, again, a little bit of a different rationale. We're coming at it learning that, when we're surveying our community, looking at our stakeholders, looking at social service agencies, healthcare providers, employers, one of the key barriers that came up across the board, irrelevant to any sector, was the transportation is a key barrier. There's specific stats that came out of a lot of the research that we were able to commission for this, which I can talk a little bit later, but really setting the table of is there a hunger in the region to look at this issue and how we can mitigate a lot of the problems in our region from that. And so we were coming at it, setting an independent table to bring people together that maybe often don't talk from a variety of sectors to work on solutions. So I'm happy to be here and with the rest of you wonderful panelists and talk a little bit more about how our work is impacting the northeastern Pennsylvania region.
Excellent. Thank you, Laura. And yes, when I started at the Philly Fed, we began to think through this idea of how do we bring our research to bear on a real actionable solutions in communities. And so we call these research and action labs, and really excited that Laura was our first research and action lab partner, and that one of the outcomes of that lab, of many really exciting outcomes, was the formation of this collaborative NEPA Moves. And it has informed conversations we've had across the region, and it's how I got to meet Richelle and hear about the wonderful work that she has been leading and the work that they're doing. So Richelle, I'll let you introduce yourself.
Thank you, Ashley. And thank you to the other panelists. And I'm really looking forward to speaking with all of you. And thank you to all the participants who have come in to listen to this presentation. My name is Richelle Todd-Yamoah, and I am the Vice President of Programs and Operations at the Pascale Sykes Foundation. The Pascale Sykes Foundation, it's a family foundation based in New Jersey, and our work focuses on empowering low-income families so that they can collectively strengthen their relationships and establish stability, and also just reach their dreams. To describe myself for the visually impaired, I am an African-American female. I have dark curly hair and dark skin, and today I'm wearing a white and black top and red lipstick. So that's me for today. We are, the Pascale Sykes Foundation is, as I said, based in New Jersey. We do fund some efforts in New York City as well, in the Bronx, and also the South Bronx. I'm sorry, in the South Bronx, and we have another agency that we fund in Jersey City. but most of our funding is in the southern part of New Jersey, which is south of Trenton, New Jersey. That's where we do most of our funding. To answer your question, Ashley, about what motivated the work, the Pascale Sykes Foundation was very interested in going into fund areas where there is very limited funding. And if you're familiar with southern New Jersey, the area is very rural and there are very few funding opportunities in this region. And so I would say back in 2011, the foundation wanted to host some listening circles, and they pulled together people from communities in southern New Jersey and really wanted to build a foundation from the ground up. They wanted to listen to the communities, what they needed, what they wanted, and that would steer and guide where the foundation would invest their efforts. And so lo and behold, many of the people in the area said that transportation was an issue for them. And as you know, I mean, southern New Jersey is sort of rural, but it's also a suburb. There are areas that is a suburb of Philadelphia. So there are transportation areas there are transportation in some areas, but the more south you go, there's many farms, blueberry farms, and the area is really a lot more rural. And people in those areas said transportation was really difficult to get to their jobs. People were walking for several miles. And so that's what came up as the most important thing for them. And it was really quite a shock for the foundation, because transportation was definitely not an area that we thought that we would be investing in at the time. We had no experience with transportation. And so it was really an area that we had to do some research and look and find partners. And so now we have been able to find some of those partners. And I think just that sort of listening to the community is what motivated the foundation to really get involved in transportation.
I love that, Richelle. And it makes me think a little bit about the opening Ben provided, where we think about power and how do we disrupt these systems. And you know, there's something really that I think we often take for granted when it comes to transportation. And it is often people in power who are making decisions, who are, you know, the people we hear from and talk to are, you know, the business owners or, you know, people who have cars. Right. And so I'm really curious, you mentioned listening sessions, and this is not a question I had initially said I was going to ask, but Laura or Tim, I know both of you have done some work. How did you flip the switch on that power dynamic to actually hear the voices of the workers who are not getting to work, right? They're not there in the conversation all the time. And they're not the people who are using these transportation systems are not usually the people we first hear from when we are identifying an economic need or a problem.
I could jump in. I'm glad you asked that, because when Richelle was speaking, I was thinking, you know, that really is so important. Whatever type of philanthropy we're doing, that we're having these conversations, and that was the driver of our movement into it as well. Is having to add a specific forum on transportation when we hadn't initially planned that, just because it was such a key barrier. And so in flipping the dialogue and making sure that we really have diverse voices, those that use transportation, those that can speak about those needs. We really made sure that in beginning it, we knew we had to commission specific research studies in partnership with the Fed and with local researchers that really got to the heart of making sure that these voices were represented, seeking out individual focus groups, holding about 12 to 15 focus groups in the region, making sure that they were available in English and Spanish, making sure that they were accessible in specific regions of the area, really getting the understanding of where are you seeing transportation barriers, and taking that and bringing that back to the group as it started to grow, and not only stopping there, but making sure that when we built this council, which was first branded as the Equitable Transportation Council that morphed into NEPA moves, that representation on the council was of those that are using transportation and was diverse and really represented a variety of power structures.
What I love about that, Laura, is also that you involve the community and the transit users in defining your problem, right? So we didn't define the problem from, like we often do, where we look at just the numbers, or where we just ask the people who are already in power in places. But you really helped the community's voice be a part of that problem definition. And it to me is really revelatory of, the work that you've done and the way it's innovated. Tim, I'd love to hear from you. Or sorry, Laura, you had something else to say?
I think that was a key part of being a part of this lab, is the design thinking element that went into it. So, I mean, that was a real value we got of being part of the mobility lab.
Right. Tim, how do you feel like your work with Ride to Work has elevated community voice and kind of flipped that power dynamic where, usually the people we talk to, they're like, I have a car, I have a garage, I live in the suburbs. What do you mean I need transportation to get to work?
Well, for us, it was fairly easy and in our face, because one of the things that we did was align ourselves with the workforce development ecosystem in Philadelphia. And, you may or may not know Philadelphia has a high poverty rate. I mean, even now, when we look at the unemployment numbers, they're double in Philadelphia. In some neighborhoods, they're even more. We work with people from marginalized backgrounds. But we heard these voices through the staff of the nonprofits that we work for, where, they're seeing people, mostly, people on the lower end of the economic ladder, and they're saying, wow, I just got offered. And I had this very same experience this morning, by the way, where, I had two people got offered a job down in South Jersey, right? Paying good money, union job, but their job developer called me and said they don't have a way to get there, right? So working with them and then trying to, uplift the voices of the people that they serve, and it really makes a difference and in addition, it makes a difference with their funders.
That's a really valuable point, Tim. And we're going to get into funding a little bit, but I'm going to ask you a follow-up question, which I'd like to ask to everyone here. The focus of this conversation in this summit has really been, how do we think about racial equity in these systems? And so I'd love to hear from each of you. How are you specifically thinking about innovating so that Black and Brown communities in particular, that we know are disproportionately transit users and in neighborhoods that may be more transit dependent? How do you see that playing into the work that you lead, Tim?
Well, let me start off. I know our first year, we tracked the data really well. And I could tell you that, something like 30% of the folks that we transported in our first year were either homeless or housing insecure people. Another 50% of those folks were returning citizens. 80-90% were Black and Brown people from low-income areas. That's exactly who we're targeting. And when we look at that, same model now, right? And by the way, Ride to Work, we are a transportation management company. So I like to tell people we're sort of like the Uber or Lyft in this space, right? So for instance, we don't own any vehicles, anything like that, but we contract with transportation partners that mirror our social mission, mostly Black and Brown, small business owners, people from the reentry community, right? And so we become sort of like a business development for that part that segment also. But we look at the equity is sort of built into our model, because and the other thing is we look at certain zip codes where poverty is higher or unemployment is higher. We'll work with elected officials in that area to try to get folks who need jobs into the jobs and get them the transportation that they need.
Excellent. Thank you, Tim. I was going to say, we have a little bit of audio feedback, Tim. I'm going to ask you to go on mute real quick and we'll see if it fixes there. Laura, we'll just keep going down the line here. Laura, tell us a little bit about how NEPA Moves has grappled with issues of racial equity.
Yeah, I think, as a community foundation, we wanted to make sure right from the beginning that when we were setting this table, that the core lens, the value that we set the table with, was making sure that we were approaching this issue and guiding everyone to approach this issue through an equitable lens. And really, it took education. It took some education and understanding and getting all of our partners to realize, well, what does it mean what does equitability mean, and doing some of the legwork to kind of highlight that. And so what that means, I think, in terms of actually influencing the work is that when we're doing the research to really understand where are the workforce access barriers, where are the healthcare access barriers within various neighborhoods outside, of the urban core, that we're making sure that is influencing. Like we said, we're flipping those flipping the structure, the power dynamic. Some of the research shows that particularly in an area like Scranton-Wilkes-Barre, which is a smaller legacy city or cities, Rust Belt economy, it's that, residents in an average neighborhood in that area can only access 12% of opportunity occupations, those occupations that don't require a 4-year degree, but pay, a good living, family sustaining wage. So they can only access 12% of these opportunity occupations with a commute that doesn't exceed 60 minutes. And then issues in terms of informational access to different types of transportation options. Are they accessible to those with various language barriers, et cetera? Just making sure that that everything we approach, whether it's workforce access, healthcare access, community development, that we're taking that equity lens. But it truly started with a focus on education for everyone at the table.
Yeah. And Laura, could you share a little? I know you guys did some equity training, and anyone else, if that's something you've gone through your organization, I'd love to hear what that experience was like. Yeah, what you learned going into it and what you learned through that process.
It started with the privilege walk exercise, and I know that is something that many people are well versed on it, but it was new to a lot of us at the table, and it really highlighted the difference between equity. What is equity, and what is equality, and what does that look like, and what does that mean for someone that relies on this transportation if there's a childcare issue, or is working an evening shift, or is trying to, go to school at night. It really had each person, regardless of whether they're the private sector, public sector, owned a company, worked in social services, worked in healthcare, put themselves in their shoes and understand, what does it mean if I really had to make these transportation routes to get from here to there, and how long would it take me, and would I be able to get to my day? It was this privilege walk exercise that I think got everybody in sync with a shared vision.
Amazing. Richelle, how have you guys grappled with this at Pascale Sykes, and particularly in your work on transportation, but even beyond that?
Well, I think we, grappled with equity. The equity issue was more prevalent for us was around economic equity. It was just around the fact that we are working in Atlantic County and Cumberland County, New Jersey, which are some of the, they have the lowest median incomes in the state, these two counties. And so, we are the equity that we were dealing with is, how do we focus on an area where people really don't have access to a lot beyond transportation, but even, just getting to jobs and getting to their work. And in Cumberland County, where we work, there's a very high percentage there's a very high immigrant population. And so, and even when we talk about privilege there, many immigrants, they just don't have we talk about privilege, don't even have a driver's license, so can't even get, access to a vehicle to be able to get to their places of work. So those are some of the issues that we, we're grappling with in terms of equity, and in the state of New Jersey in general. The southern part of the state just doesn't really, the northern part of the state where it's much more urban, and transportation wouldn't even be an issue or even be on the table for people in the northern part or in some urban areas of the northern part of the state. But in southern New Jersey, people need access to transportation. And so it's really sort of more of an economic issue here for us in the southern part of the state.
Yeah, absolutely. And I think your point about immigrant workforce, I know, is something we've seen both in Philly and in northeastern Pennsylvania. that there are really, these are both assets that we're not tapping into in terms of workers that companies would love to have working, but also people who are systemically not able to get access to these jobs if they don't have access to a car. And so it's something I think will be surprising maybe to some folks listening in, but the state of Pennsylvania, like many states, is growing in its immigrant population. And so these are things that I think a lot of regions are grappling with. I'm going to switch back to Richelle. I'm going to start with you on this question because I want to talk about disruptions and funding. Right, we're talking about systemic barriers here and systemic issues. And one of the things we see that one of the biggest systems is how money is allocated. And you really touched on it, Richelle, between even like, the northern and southern parts of New Jersey. And, we know Atlantic County had tremendous impacts from COVID-19 in terms of the tourism industry. And a lot of employment and these issues continue to grow, continue to be really critical ones. So how do you think about the work you're doing as disrupting some of these funding, and what ways have you innovated around funding systems?
Well, I think it is, like I said earlier, transportation was an area that the foundation was totally new to the work that the foundation was planning to do. And I think we disrupted funding because, transportation it's seen as a government, it should be handled by the government, or my taxes should pay for, transportation. That's not something that I would, as a donor, necessarily contribute to. That's not the first thing that would come to my mind, because it's sort of, seen as a public or federal, or, that's a government issue. And so I think, disrupted that by saying, first of all, our main focus at the Pascale Sykes Foundation is to support whole families. And we do fund and when you talk about systemic change, our approach has several prongs. We do fund some social service agencies, many of them in New Jersey, and we also fund some economic development where we, are providing funding to help support local businesses in the southern New Jersey area. And sort of a part of that was we can't necessarily support whole families if they cannot get to their place of work. And so it was sort of like a nice closing to the circle, the transportation piece. It sort of made sense after a while. I mean, at first it was like transportation, but, after we really, again, listened to the families and what their needs are, and their needs, were definitely economic. We need to be able to support our families. And so we need jobs, and we need to get to those jobs. That's where sort of the system, it just all made sense to us. And it is I think a disruptive area, but we have really been able to develop, we fund collaborations, and our efforts have pulled in the New Jersey Transit, the state transit system. So we have relationships with them now where, we are working in partnerships with the state transportation system to get these shuttle services, keep them running and get them going. And I just want to, just to add that one of the things that I think, for us as a funder that we were able to do is our shuttle services are free. So we're able to offer, as a funder, we have more leverage to say, we want to support this whole effort, and we want to make it so that people don't have to spend any funding to get to utilize these shuttle services. So, that sort of partnership, public-private partnership in this area was great. They provide the wonderful technical assistance, and the knowledge and the expertise comes from them. And then we provide the funding, and we also keep it focused on families and really helping them reach their goals.
Thank you, Richelle. And I will say, I've been out to visit, and I love the whole family approach, because to me, it also is something, we often are grappling with bits and pieces of barriers that people are addressing, and we aren't really actually addressing people as a whole, right? And that I think is just such a powerful approach to thinking about economic mobility and poverty, and honestly, how we got into this work, right? Because if we were just thinking about, oh, it's just income, or it's just, get the people, create the jobs and everything will be fine. Well, how are people getting to the job, right? And so this traditional approach we've had often overlooks the critical importance of mobility. I will also say, Richelle, we conducted a study in 2018 where we saw that this cross-county connect shuttle and the way you are connecting between the shuttles and the public transit is actually really increasing accessibility and opportunity for folks. So I'll share a little link to that. But Laura, speaking of cross-sector partnerships, this is so core to what you do. And I'm wondering if you can share a little bit about how NEPA Moves has really disrupted some of the traditional ways this funding works and the innovative partnerships you've built.
Sure. I love the talk about the holistic funding, because that became, one of the offshoots of one of our focus areas really is pilot projects that focus on families, that work with social service agencies to develop shared ride projects that look at the whole aspect of what it means to be, to have good quality of life. And so we're currently, that's part of it right now, is working with partner funders to invest in these pilot projects that, with the hopes of, after achievement of goals, after showcasing, the objectives were met, that we can have long-term sustainable funding. But when you think of, as a whole, disrupting the funding, what it really required from our perspective was it required a host, it required a community foundation or any other independent anchor institution ready and willing to make a long-term commitment, to create a line item in a budget that said transportation matters and we're going to focus on it and we're going to focus long-term on it and we're going to dedicate some resources, even part-time, to staff personnel, working with other funders in the region to perhaps add to the capacity of that individual, that role that then convened this collaborative together and kept all the balls in the air and connecting all the dots with our stakeholders, making sure that we were really developing strong, real relationships with the mass transit agencies in the area, working with the chambers of commerce. So I think it required an investment. It required a buy-in of investment from some other partners in this role. And that part-time contracted role has now transitioned 5 years in to a full-time role. So I just think it's one example of showcasing that commitment, but also enabling and I guess I should say engaging the entire collaborative to be involved in the housing process, in the employment selection process. That's one piece. Another piece I think comes down to the fact of, we realize that, as we move along, some of the funding models, again, are funded by various foundations. Another big win, I'd say, that was nice to highlight along the way that showed a little bit of disruption in funding was one of the major healthcare systems in the area willing to invest in a long-term pilot that focused on both the urban core of Scranton and a more rural area in Danville in prioritizing transportation access to healthcare under the hopes or the goals that once this pilot is completed, which is now in its third year, honestly longer than I thought it would even be, because I think it's pretty innovative, and the fact that they made that commitment is a wonderful thing, but that could potentially even become a covered benefit. So, I think that's a definite highlight of a disruption. Another piece you see is, some of these mass transit routes being partially funded, an extension, a last mile option being funded by some of the private sector in our region or CDFI. So I really think we've seen a diverse array of ways it can be disrupted. One of the things we're hoping for next is that we can perhaps engage in some more federal resources to develop a really long-term strategic transportation and workforce plan for the region, bringing it together that helps us to then go to the next phase of investment in capital projects.
Amazing, Laura, thank you. And I shared here a link very quickly to some information about the Geisinger program, which is, again, the healthcare collaborative around transportation. I will say, part of how we think about research and action labs is the action part. Like, what does it mean to really lead to innovations and new approaches to doing this work and new partnerships? And Tim, you guys have just done an incredible job putting together Ride to Work. And honestly, even in the past year, the kinds of supports that you've gotten. So I'm curious if you can share a little bit about how you think about your work as disrupting funding and how you're sustaining it.
Well, coming out of is my audio better now? Okay, cool. Coming out of, the experience with the joint access reverse commute, that was funded by the federal government, and it sort of switched over to the states and so forth. One of the things that folks were saying, that the government was saying, is that employers had to take a bigger role in this, that they were getting the benefit of this, and that they had to pony up some money and pay their fair share. The problem was that employers really didn't understand the benefit, because the providers of the transportation services looked at it sort of like a commodity, right? What we've done, Ashley, is that we talk and we explain it to our success with the employers is how it impacts their bottom line. For instance, I give you a good example. Just recently with a major employer right in South Jersey, where we were able to calculate the cost of their turnover. It was in the millions of dollars, right? And we figured out that, through data, that we could have, if we could impact that by at least 30% with a transportation system or solution, and it wouldn't cost them millions of dollars. So that made them interested. That allowed them to be interested. In addition, we also work with the nonprofit agencies, where a lot of their funding can go towards subsidizing the transportation. And of course, the riders share in a small portion of the cost. Now, the thing that could really put the icing on the cake, and what we're trying to do with the Ride to Work initiative, is to get the public sector, local governments, state governments, to subsidize it even more, just to lower the cost, particularly for the riders, so that they can enjoy not only getting rides to work, but getting rides to medical appointments and things of that sort. So we took a different approach. And once my historical background on this is, once the federal government and the state government got out of it, the systemic issue was, how do you do it? How do you pay for it? And for us, the employers make all the difference in the world. And right now, we're enjoying this situation where employers are more than willing to pay for it, because they know how it's going to affect their bottom line and get people that they need to work.
Yeah, and Tim, I just love this so much about this model. And Laura knows a lot of the case we were trying to make in Northeastern Pennsylvania was to employers about, both this is, yes, people can't get to jobs, but also employers are missing out on huge pools of extremely talented people, because we're just assuming that people will somehow get there. And both Laura and Richelle, I'd love for you to kind of share how you've had to engage with the private sector. I'm also going to lift up a question I see here in the Q&A, and please feel free to submit questions, folks. I know we've got about 15 minutes left. But one of the questions is also about different strategies for different employers. So if you find that there's, higher paying employers versus lower wage employers that are more likely or less likely to pay attention to transportation. So Laura and Richelle, I'm happy for both of you to talk about how you have tried to or been successful at engaging the private sector, and any thoughts on that question as well.
So I wanted to jump in here because we have been trying very hard to engage the private sector in our efforts, and there are many large warehouse companies of some of the largest corporations based in southern New Jersey, and we have been trying to get them involved in this issue. And ironically, what you just mentioned, Ashley, about some of the higher paying employers, we were faced with, we pay our employees a significant salary, so they should be able to afford cars. So those are some of the things that we've heard from some of the private sector in our efforts. And then there were some private corporations that decided to invest in their own transportation efforts. So it was sort of running, side by side with some of the efforts that we were running. So we have been, coming up against some barriers in trying to get additional support for our transportation efforts. And especially, I think maybe because there's a sort of comfort in knowing that there's this private foundation that is supporting, a huge part of this. And so, we really are trying now, because one of the caveats to our work is that we will be closing our doors soon. So we really are looking to increase some of the partnerships, and even some of the work that we've been impressed with the work that Laura's doing with NEPA Moves, and how you've really been able to engage the health sector. And that's one of the areas that we'd also like to, engage with, and we're trying to engage with here in Southern New Jersey, because everything that Tim talked about, talking about your return on investment. Many of the users of our shuttles use the shuttle to get to their doctor's appointments. And, and even though it's designed to get people to jobs, but, there are people who use it to take their children to daycare on their way to their jobs. There are people who are using it to get to their doctor's appointments and shopping. And so just to get, we have been trying very hard to engage some private sector companies, and it's been a challenge for us.
Yeah, I'll agree. I think that for us, engagement of the private sector, excluding the healthcare that I just spoke about, that came earlier. And I really think that really was informed by the research. I really think that the research that was conducted that just made those clear connections helped us. It helped us kind of escalate that process. I'm actually surprised, I'll mention again, that this pilot has lasted into its third year, because that tells me that the evaluations that they're seeing shows that there is ROI, that they're seeing ROI, that it's working. And that's a really positive thing. But in terms of, other businesses, I think we really had to start to think about how do we flip our conversations that, our equitable lens translates into ROI, and it translates to inclusive economic growth for the individual and for the region. And it's better for the Scranton-Wilkes-Barre region if we bring businesses to the table. And a big way that we were able to do that is really focusing on working with the chambers of commerce in both the Scranton and Wilkes-Barre area, and saying, let's have specific gatherings where we convene with various companies, with the industrial parks, and really understand where are the gaps, and where could these solutions be placed. So in essence, it became kind of like a consultancy. We're branding ourselves into kind of working one-on-one with helping to develop these solutions. But it became very much an ROI focus. I think we're even seeing it much more now because of, I hate to say post-COVID, but the equitability issues, the workforce issues post-COVID. I think there's even more of a realization, transportation is an economic issue. Let's come to the table. Let's come to the table in greater amounts. So, but I definitely think that was a challenge that we really had to intentionally focus on as we moved forward in creating the language that got people to the table with the data from the research.
Absolutely, Lauren. I'll never forget the conversation we facilitated, connecting with some regional chambers, where, the HR representatives, who are often the frontline folks, they see how this impacts their work, but it's making that case to folks even further up about this is actually worth the investment. And then also trying to understand where people were willing to take that risk, right? So when you have a program like Tim's, where they're like, great, I can provide you with funding, but, people maybe running their own bus was a risk that they felt uncomfortable about because, what if something happens? What if something happens to a driver, right? So I thought this was a really interesting lesson for us as well, in terms of how the private sector was thinking about transportation and mobility. And I'll share some of the resources. We did put together a toolkit highlighting some different ways that employers in the private sector could think about transportation and transit in their work. But we do have some questions coming in here. And Tim, I'm going to turn this one to you. I think you might have answered this, but I'd love it if you could share with others. You talked about that cost of turnover and how you were demonstrating that to employers and calculating that. And I'm wondering if you can share just a little bit about what you've learned and how you all do that.
Well, we actually developed a tool, and we try to make it simple for the employers, right? And if they don't know how to use it, we'll spend some initial time doing an initial assessment And at the end of the day, it really is very simple, but it's an eye opener for a lot of employers. We had one employer who came to us and said that they have almost 69% turnover within the first 3 months. And they felt that it was due to turnover. I mean, due to transportation mobility issues. And they calculate that at close to $4,000 per person. I mean, do the math. It's outrageous, right? And so, one of the things that we did, we says, okay, well, transportation is a part of it, but what about some other factors? What about pay? What about working conditions? Because we can get you all the transportation that you need, but if you're not paying a good wage and you're not treating people well, you're still going to have a high amount of turnover. So we've been fairly successful at that recently in getting employers to sort of look at the whole ecosystem. And once they see those numbers, and we also not just talk about numbers related to turnover, but disengagement. What happens, we had a situation just yesterday where, employer says, I got 4 people who can't come to work. One, of course, the driver for one of our vans is sick, right? Or something like that. What happens? Disengagement. They don't have enough people to do the work. They don't have enough people to get their product out. But I think once what we found is we're able to use the tools. And by the way, it's on our website. We have a sample of how that works, right? And they see the impact and they realize return on investment. It really becomes a no-brainer after that.
Thank you, Tim. So I've got a couple other questions here, and maybe I'll start with one that is specifically for you, Laura, which is about, you talked about the training you all went through in terms of the privilege walk. Are there other resources or things you would recommend for other communities, particularly looking at definitions or best practices to how to develop some of those things, like the privilege walk or other training?
Yeah, great question. I think, one of the things that our region, our community really learned from was when we were able to, again, in partnership with the Fed, host this Equitable Transportation Summit. Now that started right early in the process. And what that meant was we were bringing in other, best practices, models from maybe communities like ours, maybe having similar transportation system, what worked there, what didn't, and some understanding of how that impacts various populations, making sure that there's diverse access that truly is achieving objectives. But I think that starting out where you're truly focused on educating people with other best practices and models from, for example, Railvolution. That's a great resource that we've worked with, learned a lot from them, participated in many conferences, going to work on an equity particular cohort with them. Another one I have to say is working with the Fed directly on the Reinventing Our Communities cohort. Again, using an equity lens, really understanding what that means for a community. But I do think that education in the beginning was critically important. In addition to the privilege walk, just getting 100+ partners from every sector at the table to really understand, okay, we're coming to this with a shared vision, a shared goal, and we're moving forward from there. And then everybody can set the vision, the mission together, the objectives, and we're all accountable to that.
Thank you, and thanks, Laura, for the shout out. And she referenced the Reinventing Our Communities kind of cohort work we do, and I'm happy to share some links for that. But a lot of that is also with some colleagues we have from Race Forward who do trainings, and you can bring on to work with your organization. And so I think one of the things we've also learned is the value of having other folks come in and facilitate, because it really helps develop this sort of shared understanding of why it's so important to center equity in your work. And for folks who are, maybe hesitant or not accustomed to that approach in your region, it helps to develop that sort of shared language around the barriers that folks are facing. So we've got about 5 minutes left, and I'm going to ask you all to just close with, I'd love to hear, not everybody here today listening is in this region. And so maybe I'll start with Laura, Richelle. If you were talking to other foundations, community foundations, philanthropies, how would you encourage people to get started? What takeaways would you like them to have?
I'd say set the table, listen to your community, gauge the interest, bring partners to the table, understand, is this something that the community is willing to start to invest time and effort in, willing to have some of those difficult conversations. And then I would say from a philanthropic perspective, engage your leadership with creating support for this, and be willing to make some level of a commitment to this over the long term, because I think the worst thing that you can do is to set a table and just let something trail off and let people feel that there weren't accomplishments and that wins weren't celebrated. But I do think there has to be that long term, or at least a partial term commitment and an expectation set that you're in it for the long haul.
Right. This isn't a one meeting situation. Richelle, what about you? What are some takeaways you would have for other philanthropy?
Well, one is I totally agree with everything Laura just said. And I encourage, especially the philanthropic community, the donor community, to really, push yourselves out of the box, to really be bold and creative and think of ways that you may not traditionally think about where funding can come in. Because as philanthropists, we do have a leverage and a flexibility to really push those boundaries and really listen to the communities that we really want to have a strong effect on. Bring people together from all areas and listen. And then, as Laura said, put it on the table, but definitely even make a commitment to it. And there are many strategies that you can use as a philanthropist to push yourself out there, and maybe even take more time than you normally would. Take the time to be slow and intentional about what it is that the communities need, and be creative and bold, and push yourself to really engage these communities in ways that you may not normally do it.
Fantastic. And Tim, I'm going to close with you. What advice would you give for folks looking to do something similar to the work that you started here in Philadelphia?
Well, I agree with Laura and Richelle, where the big thing I think makes a difference is collaborate, 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 and also keep the mission in mind, right? I mean, it's interesting because a lot of folks, even in my organization, weren't even aware of the disparities and the need and so forth, and how we can impact and make a difference. But keeping that front and foremost, and collaborate with folks, and being just out of the box and coming up with solutions makes all the difference.
Thank you, Tim. And I love that. I think that is one of the things I respect most about all three of you and your work, is it really is human-centered. You really are starting and leading with the people that you are working to affect. And I deeply appreciate that. And I'm really excited to see where your projects head to next. And I'm seeing that we're running a little lower on time here. And so I just want to say thanks to everyone who tuned in. I'm going to share some resources here in the chat from our Research and Action Lab that the Philly Fed conducted on this issue. But we do hope you'll stay in touch. We'd love to hear how your communities are innovating. I hope you've learned something today from this just exceptional group of people who are being very thoughtful about cross-sector collaboration and really advancing mobility in their regions. And we'd love to hear what you're working on and how you're doing this work. So I want to say thanks particularly to the Shared Use Mobility Summit folks for bringing us in and for giving us this chance to really be empowered to talk about what we're working on. And I can't wait to hear more and learn about what you're all doing. So thank you again. And we look forward to continuing to work with all of you to advance a more inclusive recovery, which really is the most important thing we're doing here.
Thank you so much, Ashley and Laura and Richelle and Tim. That was an amazing conversation. And I want to grab everyone I know from Foundation World and say, listen, right? And my key takeaway was, you want to talk equity and economics and jobs, you have to talk transportation and mobility.